Hello, I'm Dr. Thelma Tenney with Healing Arts Institute. With all the media coverage going around about the spread of COVID-19 coronavirus, I wanted to take this opportunity to share some information from the U.S. Center of Disease Control. Many media reports are sensationalizing the event, and while it should be taken seriously, I'm going to share some information to help counter disinformation, prevent stigma associated with this virus, and to help you stay healthy. So with that in mind, let's get into it. What is COVID-19 coronavirus? Like the flu, coronavirus 2019 is a respiratory illness that can be spread from person to person. The virus that caused COVID-19 was first identified during an investigation into an outbreak originating from live animal market in Wuhan, China. But the virus is now spreading from person to person, from continent to continent. How does this virus spread? This virus is spread like many others, from person to person contact. Some viruses are more contagious than others. They are more easily spread. And this virus seems to be easily transmitted from one person to another or surface to surface. Who is at higher risk of being infected? Some people are at higher risk of getting sick from this illness, including older adults, people who are already sick or with long-term illnesses, and people who have serious long-term medical conditions such as heart disease, diabetes, lung disease, or transplant patients. If you are at higher risk of getting sick from COVID-19, you should take everyday precautions to keep space between yourself and others. Limit close contact and wash your hands often. Try to avoid crowds as much as possible. So what are the symptoms? Current symptoms reported for patients with COVID-19 include fever, cough, difficulty breathing, and symptoms are very similar to that of the cold or the flu. Watch for symptoms and emergency signs. If you develop symptoms such as fever, cough, and or difficulty breathing, and have been in close contact with a person known to have COVID-19, stay home and call your healthcare provider. Older patients and individuals who suffer from long-term conditions or who are already sick should contact their healthcare provider early, even if the illness is mild. If you are experiencing severe symptoms, stay at home and call your doctor. Your doctor will determine if you have signs or symptoms of COVID-19 and whether you should be tested. Can COVID-19 be spread through food? There is currently no evidence that suggests the spread of COVID-19 is associated with food. However, you should continue to follow sanitary food precautions, washing your hands with soap, water frequently. It may be possible that a person can get COVID-19 by touching a surface or an object that has the virus on it, and then touching their own mouth, nose, or possibly their eyes. But this is not thought to be the main way the virus is spread. What is the risk of my child becoming sick with COVID-19? Based on available evidence to date, children do not appear to be at a higher risk for COVID-19 than adults. While some children and infants have been sick with COVID-19, adults make up most of the known cases. You can encourage your child to help stop the spread of COVID-19 by teaching them to do some things everyone should do to stay healthy. Clean their hands often, using soap and water or an alcohol-based hand sanitizer, avoiding people who are sick, cleaning and disinfecting surfaces that are often used. How can I stop stigma around COVID-19? People can fight stigma by providing social support for friends and family, and counter disinformation by learning and sharing facts. Communicating the facts to others about how viruses spread can help stop the stigma. How do people protect themselves from respiratory illnesses like the cold, flu, or COVID-19? People can help protect themselves from respiratory illnesses with everyday preventative actions. Avoid close contact with people who are sick. Avoid touching your eyes, nose, and mouth with unwashed hands. Wash your hands often using soap and hot water for at least 20 seconds. Use an alcohol-based hand sanitizer which contains at least 60% alcohol if soap or water is not available. If you are sick, to keep from spreading respiratory illness to others, you should stay at home when you are sick, cover your cough and sneeze with a tissue and throw the tissue in the trash, clean and disinfect objects and surfaces. In other words, the same precautions that you would use during any other cold or flu season. Thank you for watching. Remember to visit us at healingartsfl.org. You can find the link in the description below. Stay safe and healthy, and we will see you soon. Thank you.